Hey everyone, I trust you are all doing great today. Ever wondered if you're really taking care of your teeth the right way? Well, today I'm diving into the ultimate daily oral hygiene routine to keep your smile fresh, healthy, and cavity-free. Let's go. First up, toothbrushing. Are you doing it right? Brush twice daily for 2-3 minutes. Rushing won't cut it. Use the right technique, gentle circular motions to avoid gum injury. And don't forget your tongue. Bacteria love to hang out there. Choosing the right toothbrush is crucial. Medium bristled is best for daily use. If you've had oral surgery or mouth sores, go for soft bristled. Avoid extra hard brushes. They can damage gums and enamel. And remember, replace your toothbrush every 3 months or sooner if the bristles flare out. If you've had a cold or an upper respiratory infection, change it immediately to avoid reinfection. Now, electric versus manual toothbrush, what's better? Both can be great. Electric toothbrushes offer deep cleaning, but a manual works just as well with the right technique. Choose what suits you best. Ever heard of chewing sticks? They can be a natural alternative, but you must use them correctly. Chew until the ends become brush-like, then gently apply it to each tooth surface. Be careful not to injure your gums. Let's talk flossing. Toothbrushes can't reach every corner, especially between your teeth. That's why flossing is a must. Floss before brushing to remove plaque and bacteria. Use a gentle back and forth motion, don't snap it. Aim for once a day, preferably at night. What about mouthwash? It's great, but not a replacement for brushing. Use it 1 hour after brushing for the best results. Ask your dentist to recommend the right one. Some contain fluoride for cavity prevention, chlorhexidine for antibacterial protection, and anti-sensitivity agents for sensitive teeth. And believe it or not, sugar-free gum isn't just a breath freshener. It helps stimulate saliva production, which fights cavities naturally, removes food debris and plaque after meals, and even reduces smoking cravings. Choose a gum with xylitol. It fights bacteria instead of feeding it. Lastly, which toothpaste should you use? Fluoridated toothpaste is best for preventing cavities. For kids under 2, use non-fluoridated toothpaste. And if you have sensitive teeth, go for anti-sensitivity toothpaste. There you have it. Master these daily oral hygiene habits, and your teeth will thank you. Which tip surprised you the most? Drop a comment below. Like this video? Give it a thumbs up. Subscribe for more health and wellness tips, and share this with someone who needs better oral care. See you next time.